Our next speaker is Edward Mathews. Edward is going to speak today on nursing and midwifery leadership, a legal and professional overview. Edward is Director of Professional Regulatory Services in the INMO. He leads a department which is responsible for professional advocacy, professional policy, professional education, to name but a few. Edward represents the majority of nurses and midwives involved in fitness to practice, a role in which I hope I never need his services. Edward represents the directors and assistant director of nursing sections, and as I say, he will address nursing and midwifery leadership and a legal professional overview. Thank you, Edward.
Thank you very much, Michael. It's a great honour to address the event, and I want to say hello to all of my colleagues and thank you for attending. I am charged with giving you a legal and professional overview in relation to nursing and midwifery leadership, and what I've chosen to do is to stay away, if you like, from the technocratic legal elements and to focus instead largely on the ethical and moral components of nursing and midwifery leadership in the current circumstances, the circumstances you've faced over recent months and the circumstances you continue to face and will face, regrettably, for some months to come in the context of the pandemic, but also the context of the broader challenges facing the health service. I want, in the first instance, to reflect initially on some important elements, and I had the benefit of hearing Karen's introduction and the General Secretary, and also Rachel's excellent reflections on nursing and midwifery currently and into the future. But we mustn't forget that this is the International Year of the Nurse and Midwife, and we're in the midst of the Nursing Now campaign as well. And we have to remember the contribution that we have made to our society and that you have driven in the making to our society in the recent past. Nursing and midwifery makes an extraordinary contribution to the lives of so many people in our state on every day of the year. But the contribution made during the pandemic has been beyond description in words that I have, and the value that that holds for our society and the value that that holds for our professions cannot be forgotten, and we cannot forget the contribution that our members have made and that your colleagues have made and that you have made in leading them in helping our society in recent times manage one of the greatest challenges in living memory. And I also want to remember and to launch my presentation by saying that you are the leaders of the largest, omnipresent, most impactful group of healthcare professionals in the state. And that's something Rachel picked up on as well and mentioned. We are there 24 hours a day, 7 days a week, 365 days of the year. We may have and often do have genuine grievance and complaint that we're not sufficiently listened to, and we work hard to position ourselves and to advocate on behalf of our staff and our patients and service users to ensure that we get our message across. But there's a reason for that, and I think it's the way Rachel described it is quite excellent when she said, we're the translators. We're the people who know what the service needs, what the service users need, and what the service delivery requires in order to meet the needs of service users. And you should not underestimate on any occasion the impact that you have had and will continue to have in that regard. But the current practice environment is extremely challenging. And I want to reflect on that because I do have the privilege of representing nurses and midwives and nurse and midwifery leaders individually in the context of the highly regulated environment in which healthcare is delivered and the highly regulated environment for nursing and midwifery, and not to forget that nursing and midwifery leadership is highly regulated. And I don't say that in a challenging or chastising or a frightening sense, but the reality is that I represent a large number of nurse and midwife leaders every year in relation to challenges they face in their work environments, in relation to advocating for themselves, for their staff, and for the patients and service users they're serving, and when nursing and midwifery leaders are challenged in relation to the decisions that they have taken. And that's the context in which I want to reflect on the practice environment, our non-negotiable moral compass, and the effect as well that has been had on nursing and midwifery leaders and the recognition of that. So we obviously have a very volatile practice environment at the moment. We have novel care practices have developed at huge pace and continue to develop at huge pace in the context of the pandemic. And then we have a reform agenda on top of that. There's enhanced PPE, there's staffing pressures, there's ethical challenges, and these are significant at the moment. Obviously, one couldn't not mention specifically COVID-19. There is no rival in living memory of the challenges we've faced. The only memory we have, and we largely rely on literature to report it, is the 1918 Spanish flu pandemic. And that began in 1918 with victory only declared in December 2020. We obviously hope for a shorter time frame with reference to a vaccine and others, but it's a point to make that there is an historical precedent, and that historical precedent does have something to teach us. And even though it was some time ago, reflections on leadership during the last pandemic that affected our world in the way that this pandemic is affecting our world tells us that there are three things that we essentially do and that should occupy us in everything that we do in the current context, and indeed more generally, in that every decision we make is trying to maximize success in terms of safety, to minimize harm, and to act as a moral agent, as a leader, and in the context of a profession which is fundamentally underpinned by a moral and ethical framework in a relationship that binds us together as professionals, which binds us with our patients, and which binds us with our society. And there's a legal underpinning to that framework as well. And nursing and midwifery leaders, as you know, play a pivotal role in balancing the needs of their staff and their patients. And in that context, and in particular when having to make substantial decisions under significant pressure, maintaining one's moral compass during these critical decision times is of the utmost importance. And again, as I've said, focusing on the minimization of negative impact and the maximization of success, and to avoid moral distress, which I will come back to in a moment. But the shared values of our professions, it is my assertion to you, create the basis for authentic professional leadership in this difficult time, and at all times, but in particular at this difficult time. And you are critical members of the executive management teams throughout the health service, and you give the voice of the reality of the front line of service provision more than any other leader in the executive management team of the health service. And you are, without doubt, of necessity, of right and of duty, the truth tellers of the system. And that can sound trite, but it is important, because the truth of service provision can become masked by rhetoric, by political statements, and by others who have agendas. Our agenda is to tell the truth of service provision, to make sure that we get the basics right, to make sure we mind our patients, and to make sure we mind our staff, if you'll excuse the colloquialisms. And I'm motivated, and in talking to nursing and midwifery leaders over the last number of months, and in my ongoing work with them, of the number and weight of decisions that are being made, often in straitened circumstances and often under great time pressure. And that tests the moral bandwidth of any leader, and will have and has done with nurse and midwifery leaders throughout the pandemic. And we have a significant degree of ethical challenges we have encountered throughout the pandemic to date, and will continue to encounter. One hopes not to a huge extent, but in reality we have encountered them and will continue to encounter them. And obviously we are an entirely patient and service user focused profession, and that requires us to have an ethical focus in the manner in which we lead our staff, the manner in which we lead service provision, and in the manner in which we advocate. And that requires, as you'll immediately know, for us to have a moral awareness when we're making decisions, identifying the ethical dimensions, having a situational awareness of the ethical issues involved in the perspectives, and acting as a moral agent, analysing what is the right action and making the right decision based on the circumstances we face. And if we ever thought that there was a question as to whether ethics and morals comes into our decision making, this is a slide which is taken from one of a number of national governmental publications around ethical decision making during a pandemic. Some of the contents of those documents would be frightening to us and remain frightening to us. But while there are high-level ethical decisions that motivate us all and that we all would be terribly concerned about, and thankfully we're not in the stage of rationing care or things like that, but there are other ethical decisions which may be equally impactful for individual patients or service users or staff, which continue to have to be made, continue to be made in pressured situations, and continue to be made in circumstances of services which are under significant pressure. So the ethical and moral awareness is huge, and the potential for moral distress among us, among you, should I say, as nurse and midwifery leaders, among the staff and among others, is quite substantial as well. Now, obviously, we use ethical frameworks to assist us to make decisions. They help us to analyze situations and apply ethical principles. We don't often reflect on them to any great extent. We know we have our code, we know we can be judged by it, but it is an empowering document. It is a binding contract between us as professionals, between us and our patients, and between us and the state. And it gives us principles that help animate and inform the decisions that we make. And they talk about things like autonomy, beneficence, non-maleficence, and justice. And they allow us to apply these principles. The ethical frameworks allow us to apply these principles in deciding how to advocate and in deciding what the right decision is in a particular set of circumstances. But unfortunately, we're often faced with ethical dilemmas, as we know, and dilemmas lead to conflict between personal and professional values, or a professional conflict with an organizational imperative. You need to open those beds. You don't believe you have enough staff. You need to deploy people to that area, but then you have the problem of who's left behind. And these are difficult situations ethically that present themselves on a day-to-day basis. And such conflicts can and do, under the most normal of circumstances, lead to moral distress for nurses and midwives, both for frontline nurses and midwives and for nursing and midwifery leaders. And I think we have to, as a profession, reflect on moral distress. And you're going to hear later in your discussions today about surveys that we have conducted and the state of the mental health and psychological health of the profession in light of the COVID-19 pandemic, notwithstanding other challenges. And moral distress is a significant worry at present for frontline nurses and midwives and for nursing and midwifery leaders. And you will know that moral distress is the psychological manifestation of doing something that you feel that is morally wrong, but the circumstances demanded that you do it. And many of you will suffer from moral distress arising from the manner in which you had to provide care or will have to provide care in the most unusual of circumstances. And this is a rational response. It's a response that we must recognize. It's a response we must talk about, and it's a response we must manage as well. But unfortunately, nursing and midwifery leaders are often held to a higher standard even of ethical behavior than frontline staff, because they have a duality, and you have a duality of responsibility, and that is doing what's right for the patient, but also doing what's right for the staff you serve and manage. And frontline staff, I suppose, in those leadership roles are not so different in that regard, in that both will experience moral distress if they're unable to react ethically to a situation, but the situation which causes the distress may be different. And of course, the overarching problem that we have that leads to some of these pressures at this moment in time is the traditional, in what should be entirely patient-focused decision-making, and the potential for public health-focused decision-making. But equally, we could have patient-focused decision-making versus organizational imperatives versus finance versus staffing resources. And all of those conflicting paradigms can lead to moral distress. So what do we have recourse to then? And what is it that we can rely upon? And I made the point, and I reflected with you, that my view that authentic nursing and midwifery leadership at this moment in time relies on the shared values which underpin our professions, and they are set out in our code as issued by the board. And it's a document that we look to from a regulatory point of view, but it also should be a motivating, inspiring, informing, and underpinning and foundational document which sets out those values and principles which we should have in our minds when we make decisions or when others call upon us to do something that we do not think is right. We have this moral compass an ethical compass from our code, and we are, and I stress this, entitled, not only bound to, but entitled to rely on it, to resist those who would try to motivate us to act in a manner which is ethically and morally incompatible. And that code is a solemn bond. It's a solemn bond, as I've said, between us as professionals. It's a solid bond between us and the state, and it's a solemn bond between us and our patients. And it's our license as nurse and midwifery leaders and as nurses and midwives on the front line. It's our license to act and speak. And in a moment where you wonder if you have a voice here, it's also a reminder that we have that bond with each other and we have that bond with society. And the chief nurse talked about the trust, and that trust arises from that ethical underpinning of our professional practice. And this bond, this code, and these moral and ethical principles give us a right to speak up, to speak out, and to be heard and to be supported. They underpin who we are as professionals. They underpin the decisions we take, leading the professionals around us to do the best for patients in the circumstances which present themselves. And they're also a right for us to say no. It's a right to say no, that there are some things that just cannot be within the gift of nursing and midwifery because it is not within the gift of our moral and ethical compass. And I know time is short, so I've kept my presentation brisk and hopefully within time, Chair. But to conclude, you are all working as nursing and midwifery leaders in a way that maximizes successes, minimizes harm, and you all aim to act as a moral agent. I think in managing the staff and in leading the staff that are around you, you will want to empower them and to be a truthful communicator with them, because they will be relying on you for authentic information and the best possible information that you can give them. One thing that I would say to you, that in leading our professional colleagues who make such an extraordinary contribution to the lives of people in our state, that we have a moral compass which underpins our professional practice. It is a moral compass by which we are judged, but it is also a moral compass by which we lead, and that it is non-negotiable. And I support many nursing and midwifery leaders using the code, saying this is not negotiable. This is how we deliver care. This is our duty to our patients. This is our duty to ourselves as professionals, and it is non-negotiable. That is not an easy position to be in. There are multiple pressures from multiple sources, and resilience is a big word, as the chief nurse said, but it's difficult in these times. What we do need to recognize for nursing and midwifery leaders is the capacity that we have, the good that you have done, the ability that you have shown, the capacity that you have shown, and the moral compass that you have displayed in leading the service. But we also need to recognize for each nurse and midwifery leader that exists within the system, that what has happened in the system and what is happening in the system and what will happen in the system results in pressure. It results in an effect on nurse and midwifery managers, and there is a need for self-care, and to take a moment and to step back and to say that there are moral and ethical dimensions and pressures which have emerged in this pandemic and will continue to emerge, and that they do leave a residue on each person, be they a leader or be they the person delivering care. We need to recognize that, and we need to talk about it as a profession, and we need to ensure that we care for each other so that we can continue to be as impactful as we have been and will continue to be in serving the citizens and people in this country. Thank you very much, Chair.